Understanding diarrhea, why it matters. Diarrhea. It's a common ailment, yet it can be disruptive and concerning. It affects millions of people worldwide every day, causing not just physical discomfort, but also emotional and social distress. We've all experienced it, that urgent need for the bathroom, the discomfort, the disruption to our day. It can strike at the most inconvenient times, making it difficult to focus on work, school, or even enjoy a simple meal with friends and family. But beyond the inconvenience, understanding diarrhea is vital. It's not just about the immediate discomfort, it's about recognizing what your body is trying to tell you. Diarrhea can be a symptom of various underlying conditions, ranging from mild to severe. It can be a sign of something minor, like a reaction to a new food or a temporary infection, or it can signal a more serious health issue, such as chronic digestive disorders or infections that require medical attention. This essay explores diarrhea, its causes, and how you can find relief. We'll look at the different types of diarrhea from acute to chronic, and what each type might indicate about your health. We'll delve into the different types, pinpoint common triggers, such as dietary choices, stress, and infections, and how these factors can affect your digestive system, and provide practical solutions for prevention and treatment. From dietary adjustments and hydration tips to over-the-counter medications, and when to seek professional medical advice, we'll cover it all. Knowledge is power, and when it comes to your health, especially digestive health, understanding is the first step towards feeling your best. By being informed, you can take proactive steps to manage your symptoms and improve your overall well-being. Let's begin our exploration of this common, yet often misunderstood condition. We'll break down the science behind diarrhea, discuss its impact on daily life, and share stories from individuals who have successfully managed their symptoms. By the end, you'll be equipped with the knowledge to manage diarrhea effectively and safeguard your digestive well-being. You'll learn how to listen to your body, make informed decisions, and take control of your health journey. Diarrhea is characterized by loose, watery stools that occur more frequently than usual. It is a common condition that affects people of all ages and can be caused by a variety of factors. Understanding what diarrhea is and how it manifests is crucial for managing it effectively. It's not just about the consistency of your bowel movements, it's also about the frequency. The number of times you pass stools in a day can be a significant indicator of whether you are experiencing diarrhea. While what's normal varies from person to person, passing 3 or more loose stools in a day generally indicates diarrhea. This frequency can disrupt your daily life and may lead to dehydration if not managed properly. There are 2 main types, acute and chronic. Each type has its own set of causes, symptoms, and treatment options. Acute diarrhea is like a sudden storm, short-lived and often caused by a virus or bacteria. It can come on quickly and may be accompanied by other symptoms such as nausea, vomiting, and abdominal pain. Think of the dreaded 24-hour bug. This type of diarrhea usually resolves on its own within a few days, but it can be quite uncomfortable while it lasts. Chronic diarrhea, on the other hand, is like a persistent drizzle, lasting for weeks or even months. This type of diarrhea can be more challenging to manage and may require ongoing medical treatment. It may signal an underlying condition like irritable bowel syndrome or IBS or Crohn's disease. These conditions can cause long-term digestive issues and require a comprehensive treatment plan. Understanding the difference between acute and chronic diarrhea is crucial for seeking appropriate treatment. Acute diarrhea might just need rest and hydration, while chronic diarrhea often necessitates a more detailed medical evaluation. While acute cases often resolve on their own, chronic diarrhea requires medical attention to address the root cause. Ignoring chronic diarrhea can lead to more severe health issues, including significant weight loss and nutrient deficiencies. Therefore, if you experience persistent symptoms, it's essential to consult a healthcare professional for a proper diagnosis and treatment plan. What causes diarrhea? It's like a detective story with various potential culprits. One of the most common is infection. Harmful bacteria and viruses can wreak havoc on your digestive system, leading to inflammation and, you guessed it, diarrhea. Food sensitivities and intolerances are another major player. When your body can't properly digest certain foods such as lactose in dairy products or gluten in wheat, it can trigger an inflammatory response in the gut, resulting in diarrhea. Medications, especially antibiotics, can disrupt the delicate balance of bacteria in your gut, leading to diarrhea as an unwelcome side effect. And then there are digestive disorders like IBS and Crohn's disease, which can cause chronic diarrhea due to underlying inflammation and changes in bowel function. And let's not forget about stress, which can also manifest in digestive distress, including diarrhea. Infections are a leading cause of acute diarrhea. These infections can be caused by a variety of pathogens, including bacteria, viruses, and parasites. Each of these microscopic invaders has its own unique way of disrupting the digestive system, leading to the uncomfortable and often debilitating symptoms of diarrhea. Bacteria like E. coli and Salmonella, often found in contaminated food or water, can infect your digestive tract, leading to inflammation and diarrhea. These bacteria are particularly notorious for their ability to thrive in environments where hygiene is compromised. When ingested, they attach to the lining of the intestines, releasing toxins that cause the cells to secrete excess fluid, resulting in diarrhea. The severity of the infection can vary, with some cases being mild and others requiring medical intervention. Viruses such as norovirus and rotavirus are also common culprits, especially in children. These viruses are highly contagious and can spread rapidly in settings like schools and daycare centers. Norovirus, often referred to as the stomach flu, can cause sudden onset of severe vomiting and diarrhea. Rotavirus, on the other hand, is a leading cause of severe diarrhea in infants and young children worldwide. Vaccination has significantly reduced the incidence of rotavirus infections, but it remains a concern in areas with low vaccination coverage. These microscopic invaders can spread quickly through contaminated surfaces, food, and water. Poor hand hygiene, inadequate sanitation, and improper food handling are common ways these pathogens are transmitted. Once they enter the digestive system, they can multiply rapidly, overwhelming the body's defenses and leading to symptoms like diarrhea, abdominal pain, and dehydration. Preventing the spread of these infections requires a combination of good hygiene practices, safe food handling, and access to clean water. Food sensitivities, unlike food allergies, involve the digestive system rather than the immune system. While food allergies trigger an immune response that can be life-threatening, food sensitivities typically cause less severe but still uncomfortable symptoms. These can include bloating, gas, and diarrhea. Understanding the difference between food allergies and sensitivities is crucial for managing your diet and avoiding unnecessary restrictions. Lactose intolerance, for example, occurs when your body doesn't produce enough of the enzyme lactase, which is needed to digest the sugar lactose found in dairy products. Without sufficient lactase, lactose remains undigested as it passes through the digestive system. This can lead to symptoms like gas, bloating, and diarrhea. Lactose intolerance is more common in certain populations and can develop at any age. This undigested lactose ferments in the gut, causing gas, bloating, and often diarrhea. The fermentation process is carried out by bacteria in the colon, which produce gases like hydrogen, methane, and carbon dioxide. These gases can cause significant discomfort and contribute to the symptoms of lactose intolerance. Managing lactose intolerance often involves dietary changes, such as reducing or eliminating dairy products or using lactase supplements. Gluten sensitivity, another common culprit, triggers an immune response in the small intestine, leading to inflammation and digestive woes, including diarrhea. Unlike celiac disease, which is an autoimmune disorder, non-celiac gluten sensitivity does not cause damage to the intestinal lining. However, it can still cause significant discomfort and impact quality of life. Symptoms can vary widely and may include abdominal pain, bloating, and changes in bowel habits. Recognizing the signs of food sensitivities and getting tested can help you pinpoint triggers and make dietary changes to avoid those troublesome foods. Keeping a food diary, working with a healthcare professional, and undergoing specific tests can help identify which foods are causing symptoms. Once identified, eliminating or reducing these foods from your diet can lead to significant improvements in digestive health and overall well-being. It's important to approach dietary changes with guidance to ensure nutritional needs are met. Medications, while often necessary, can sometimes have the unfortunate side effect of diarrhea. Antibiotics, in particular, are known to disrupt the balance of bacteria in your gut. While they kill off harmful bacteria causing an infection, they can also wipe out beneficial bacteria, leading to digestive upset, including diarrhea. Digestive disorders like irritable bowel syndrome, IBS, and inflammatory bowel disease, IBD, which includes Crohn's disease and ulcerative colitis, are characterized by chronic inflammation in the digestive tract. This inflammation can disrupt normal bowel function, leading to a range of symptoms, with diarrhea being a hallmark complaint. If you suspect your diarrhea may be a side effect of medication or a symptom of an underlying digestive disorder, it's essential to consult with your doctor. They can help determine the cause and recommend appropriate treatment options. Stress, that ever-present companion in our modern lives, can wreak havoc on our bodies, including our digestive systems. When you're stressed, your body releases hormones that can affect your gut motility, leading to diarrhea or other digestive discomforts. While most cases of acute diarrhea resolve on their own within a few days, there are warning signs that should prompt you to seek medical attention. These include blood or pus in your stools, high fever, dehydration indicated by excessive thirst, dry mouth, dizziness, and decreased urination. Don't hesitate to reach out to your doctor if you experience any of these symptoms. Prompt medical attention can help prevent complications and ensure you receive appropriate treatment.